Well, thank you very much, and I just want to add in my own personal experience with electronic health records as a doctor, and it's much more than 2 hours of my time after seeing 35 to 40 patients in a day. Just as an example, on a global post-op no charge, after I finished completing my medical record, it took an additional 6 clicks to put in no charge. Now it takes me 10 seconds to write in-C. It took 2 minutes to 6 clicks to no charge. So it certainly does lead to burnout. I'd also like to follow up on something Dr. Longhurst said, and then also Dr. Schlosser. And certainly the FDA has not kept up with medical devices utilizing artificial intelligence, not only generative, but repetitive machine learning. And at the University of Iowa, Dr. Michael Abramoff, MD, PhD, has one of those first medical devices that's approved by the FDA. And then I'd like to submit for the record an article on effectiveness of artificial intelligence screening and preventing vision loss from diabetes, a policy model. And then that would lead to reimbursement. And what's great about this is that it increases access by having a device that can be put into any person's office, whether it's an eye care provider or family practitioner. And then the second letter is a letter of support from Johnson & Johnson that does talk about privacy, equity, bias, and transparency in the system, since those things have been brought up.
Thank you. We're going to accept the documents list at the end. We'll make sure those are included and give my friend here a chance to review. Thanks.
I know I did it first because I'm older and I forget things. So Mr. Shin, we've heard a lot about AI over the past few years and the potential risk attributed to unregulated AI integration. However, the FDA has been regulating software-based medical products since the 1970s, and we know that AI integration into healthcare has already raised the status quo of care. We have seen it in digital pathology, drug optimization, integration in patient engagement, personalized risk prediction. Can you give examples where gaps exist in current regulation that Congress can address to ensure continued innovation that will drive better, more personalized care for patients without burdensome overregulation?
Yeah, thank you for the question, Congresswoman. I think what we're seeing with the FDA, and we continue to work very closely with the FDA to try to make sure that they stay current with the rapidly changing technologies that are there. I think the challenge that we're seeing is that, and it was acknowledged here on this panel today, is really how artificial intelligence continues to change, and what becomes an AI algorithm today might be a different AI algorithm tomorrow, or might need to be adjusted or increased in terms of accuracy or whatnot after it's being used in the clinical setting. So I think this is where areas like PCCP that we had worked on here with this committee previously, these are all important aspects that the FDA needs to consider and actually not water down in terms of its ability, because that actually then will inhibit us from being able to continue to develop and innovate in this particular area.
Thank you. Dr. Schlosser, many hospitals and hospital systems are facing significant staff shortages. We're seeing AI as a meaningful tool to help alleviate some of the administrative burdens that are driving providers away from the medical profession. A recent report from Goldman Sachs notes that shifts in workflows triggered by these advances could expose the equivalent of 300 million full-time jobs to automation. What steps can Congress take to facilitate better AI integration to health systems to streamline processes that will allow healthcare professionals to focus more on patients and less on billing, coding, et cetera?
That's a great question, Congresswoman. Thank you. And I think this is incredibly important that we do streamline our ability to use AI to tackle this serious workforce problem that we have that is only going to continue to get bigger. We think the gap between supply and demand for nurses alone is going to continue to increase over the next decade. And so I would say the easy answer is let's not put too many burdensome regulations between us and our ability to deploy AI to support our healthcare workforce. We're not talking about AI directly influencing patients or providing diagnoses. We're talking about it removing administrative burden. That is an area where, with the right responsible AI platforms, we should be able to move quickly to adopt those technologies and free up that workforce to handle this increasing demand.
Well, thank you, and I saw Dr. Nguyen and Dr. Longhurst shaking their heads, so I think that you're in agreement, and since I'm running out of time, I've got another question I'll submit for the record, and with that, I yield back my time. Thank you so much.